The Nigeria Center for Disease Control and Prevention has confirmed 39 cases of Mpox in the country. The NCDC says Nigeria is expecting 10,000 doses of Janus vaccine as it considers the vaccination for high-risk groups for Mpox. TVC News' Kemi Balogo reports.
The alarming increase in Mpox cases is due to a new strain of the virus, which emerged in eastern Congo and has since been detected in Kenya, Rwanda and Uganda. So far, about 2,863 confirmed cases and 517 deaths across 13 African countries have been reported this year alone. In Nigeria, a total of 39 confirmed cases with no deaths have been recorded across 33 states and the FCT from January this year. The Nigeria Center for Disease Control says it is putting all port health services across all 5 international airports, seaports and land crossing borders on high alert.
We are working with the port health services. Along this line, 5 designated international airports and some key seaports, including land and foot crossing borders, have been placed on high alert. Declaration forms have been distributed to airlines, especially those coming in from countries where there is an ongoing outbreak of Mpox in the last 90 days. Treatment protocols and diagnostic tool protocols according to the IDSR are now distributed to various states. All states have also been put on high alert, including Lagos, Abuja, Enugu, Kano, Rivers State, Cross Rivers, Akwa Ibom, Adamawa and Taraba.
The Disease Control Agency also says the National Mpox Technical Working Group will continue to coordinate Mpox response activities across the country.
The exact reservoir of the virus is still unknown, although rodents, squirrels, and monkeys are suspected to play a part in transmission. The Mpox virus can spread from both animal and human, and animal to human, and also from human to human.
The World Health Organization had declared the ongoing Mpox outbreak as a public health emergency of international concern just about 24 hours after the Africa Center for Disease Control declared it a public health emergency of continental security due to an upsurge of cases in the Democratic Republic of Congo and a growing number of countries in Africa. Kemi Balogun, TVC News, Abuja.
Joining me now is a family physician at the National Hospital in Abuja, Ajima Onize, for more on this outbreak. Dr. Onize, thank you for joining us on the news this hour. We're looking at 39 cases, 8 states and the FCT now put on high alert. What more should Nigerians know about this outbreak, especially the symptoms they need to look out for?
Thank you very much. Thank you, everyone. Good day. So, actually, monkeypox, also called Mpox, is a very deadly disease, even though before now it was a rare disease, and it's actually transmitted from animals to humans. But after humans are infected with the monkeypox virus, it can now be transmitted from animals, from humans to humans, and it can also be transmitted even from mother to child. It can even be transmitted by mothers to babies in their wombs. And this disease, since it was first reported in around 1970 in humans, and it was first isolated in monkeys in 1958. Since the first human case of this disease, there's been over 1,200 deaths from this disease. So I'm going to talk on how we can prevent this new disease that is ravaging humans called monkeypox. The prevention actually starts from knowing fully what are the risk factors or what are those things that make it possible for humans to get infected with this virus. First is having frequent contact with wild animals like rodents, squirrels, rabbits, and either being bitten or having scratches from these animals. Also, eating undercooked bushmeat is also a very important risk factor. Then poor hygiene, when you have rats or rodents. Also, either from hello, can we hear me?
I can hear you, Dr. Onize. Please go ahead.
Okay. So first we have to ensure that when we're eating this bushmeat, that's if you really have to eat it, it has to be well cooked. And anybody that has the symptoms, which I'm going to talk about, should actually visit the healthcare facility immediately. How can we prevent it? One, ensuring that you have less contact with rodents, ensuring a good personal hygiene, ensuring that when you get symptoms, you get to the health facility and get treated immediately. Also, vaccination, adequate vaccination of the routine vaccines, because vaccination against smallpox actually reduces your risk of being infected with monkeypox virus. What are the symptoms to look out for? It can start with fever, cough, swellings around the neck, or swellings even around the ear. It's called lymphadenopathy in medicine. There can be headache, back pain, general body weakness, and at times, at the initial stage, people mistake these symptoms with symptoms of malaria until they start noticing the classical symptom, which is the development of the characteristic rash.
All right.
Which is the monkeypox rash. And that one thing about that rash is that it affects the mouth, it affects even the palms and the soles of the feet. So those are characteristics of the monkeypox rash.
I hear you, doctor. The thing is, many Nigerians live peacefully with rats and other rodents in their house. You're saying that has to change. But quickly, talk about the current state of vaccine availability and distribution for this new strain.
Okay, so currently in the country, the vaccine are not yet widely available in the country. And at times, we depend on support and donations from the developed countries, in quotes. So the vaccines are limited, though they are available in designated regions. So you can speak with your healthcare professional, or you can visit your healthcare center to discuss the availability of the vaccine and where to get it.
Ajima Oneze is a family physician at the National Hospital in Abuja. Thank you for talking to us.
Yeah, you're welcome. Thank you so much.